Hey, welcome back. I'm Dr. John. And if this is your first time here, I want you to understand something important. Everything I share on this channel comes from one simple place, a sincere desire to help you live longer, feel stronger, and make wiser decisions about your health. And today, I'm going to say something that may sound surprising, especially coming from a doctor. I'm going to tell you about 5 medical checkups that I personally would choose not to get after the age of 60. Now, before you click away or assume I've completely lost perspective, stay with me for just a couple of minutes, because what I'm about to explain could spare you from unnecessary worry, expensive procedures, avoidable risks, and in some cases, and this is the most important part, treatments that can end up causing more harm than the issue they were meant to solve. There is a conversation happening in medicine right now, not out in the open where most patients hear it, but in research papers, ethics boards, and honest conversations between physicians. And that conversation is this: more testing does not always lead to better health. In fact, sometimes more testing leads to something medicine calls overdiagnosis and overtreatment. And for people over 60, this isn't a small issue. It can become a serious one. Because once testing starts uncovering things that may never have caused any real problem, it can set off a chain reaction. Biopsies, medications, surgeries, specialist appointments, anxiety, side effects, and complications. And a body at 65, 70, or 75 does not recover from those interventions the same way a 35-year-old body does. Now, let me be very clear from the beginning. I am not telling you to avoid doctors. I am not telling you to ignore your health. Absolutely not. What I am saying is that there's a real difference between healthcare and sick care. There's a difference between a test that truly benefits you and a test that simply creates fear, follow-up procedures, and sometimes real harm. And as someone who has spent decades in medicine, someone who has sat across from countless patients and watched what happens when testing goes too far, I feel an obligation to have this conversation honestly. So let's talk about it. These are the 5 medical checkups I personally would avoid after 60, and more importantly, I'm going to explain why, what the evidence says, and what you may want to focus on instead, because there is almost always a better path. 1. Routine full-body cancer screening. Let's begin with the first one. And yes, I know this may upset some people. Routine annual full-body cancer screening. I can already hear the reaction. But doctor, aren't we supposed to catch cancer early? Isn't early detection always better? That sounds reasonable, and emotionally it makes perfect sense. We've all grown up with the message, find it early, treat it early, save your life. But the science, especially in adults over 60, is much more complicated than that simple story. What research has shown is that broad screening approaches, things like whole-body CT scans, full-body MRI packages, and some of these commercial cancer blood panels being marketed directly to the public, have not consistently been shown to reduce death rates in healthy older adults in the general population. What they often do instead is detect something. A spot on the lung, a tiny shadow on the kidney, a slightly abnormal marker in the blood. And once that happens, you enter a system. You get more scans. You get referred to specialists. You may end up getting biopsies. You become worried. Your family becomes worried. And in many situations, what was found was never going to hurt you at all. In medicine, these are often called incidental findings, abnormalities that sound alarming but would never have caused symptoms, disability, or death. There's also an important concept in oncology known as indolent cancer, cancers that grow so slowly and are so unlikely to become dangerous that many experts argue they should be labeled differently because the word cancer itself triggers fear and aggressive treatment. And here's the key point. As we age, the body tends to accumulate more of these slow-moving or clinically unimportant abnormalities. Your immune system has been identifying and managing microscopic changes for decades. The human body is extraordinary that way. But when we go looking everywhere with extremely sensitive technology, we find things, and then we feel compelled to act on them. The problem is that the treatment itself, surgery, radiation, chemotherapy, invasive follow-up, may create more harm than the original finding ever would have. That doesn't mean all cancer screening is bad. Not at all. There are evidence-based screenings that absolutely make sense for the right person. Colon cancer screening up to the appropriate age. Mammograms based on guideline recommendations. Low-dose lung CT scans in current or former heavy smokers. Those are targeted, evidence-supported decisions. What I'm warning against is the commercially marketed one-size-fits-all peace-of-mind full-body cancer scan or broad cancer blood panel offered to healthy adults over 60. For many people, it delivers the opposite of peace of mind. A better approach? Talk to your doctor about which specific screenings actually fit your age, family history, and personal risk factors. A personalized conversation is far more valuable than an expensive blanket scan. 2. Aggressive cardiac stress testing in people without symptoms. The second checkup I would think very carefully about is routine cardiovascular stress testing in adults over 60 who have no symptoms. Now let me clarify something important. If you are having chest pain, shortness of breath, heart palpitations, dizziness, unusual fatigue, or anything that raises concern about your heart, that is a completely different situation. In that case, testing may be absolutely necessary. What I'm talking about is the person who feels fine, has no cardiac symptoms, but wants a stress test just to be safe as part of a general wellness check. That sounds proactive, but that doesn't always mean it's helpful. Major medical organizations have stated that there is not strong evidence that routine stress testing in asymptomatic adults improves outcomes. And one major reason is this. These tests can produce false positives. In other words, the result suggests a problem when there may not be one, or when the finding is not actually significant enough to matter clinically. And once that happens, more testing usually follows. That may mean a referral for a coronary angiogram, an invasive procedure where a catheter is inserted into the artery and contrast dye is used to look at the heart's blood vessels. Yes, angiograms are commonly done. Yes, they can be very useful in the right patient, but they are still invasive, and invasive procedures carry risks: bleeding infection, artery injury, contrast reactions, kidney stress, and in rare cases, serious cardiac complications. I've seen healthy people get pulled into this exact cycle. They felt fine. A routine test came back abnormal. More procedures followed. Complications happened. And in the end, the original concern turned out not to be clinically meaningful at all. So what makes more sense instead? Focus on the things that clearly reduce heart risk. Monitor your blood pressure, check your cholesterol, know your blood sugar or A1C, maintain a healthy weight, walk regularly, sleep properly, manage chronic stress, eat real, minimally processed food. These interventions are boring compared with a high-tech test, but the evidence behind them is vastly stronger. If your symptoms or risk profile justify more testing, that's a different conversation. But a routine stress test with no symptoms and no clear reason, that's not something I would personally rush into. 3. Bone density testing too often. The third checkup is one that often starts out reasonably, but then becomes excessive. Bone density screening repeated too frequently. Now let me be balanced here. A DEXA scan is a legitimate medical tool. Bone health matters. Osteoporosis is real. Hip fractures in older adults can be life-changing and even life-threatening. So I am not saying bone density testing has no value. What I am saying is that many adults over 60 are getting these scans more often than necessary, and sometimes mild findings are leading to aggressive treatment too quickly. For example, someone gets a scan and is told they have osteopenia, meaning their bone density is lower than ideal, but not necessarily in a high-danger range. Then almost immediately they are prescribed medications such as bisphosphonates. These medicines absolutely have a role in the right patient, but they are not risk-free, especially when used for years. Potential concerns include osteonecrosis of the jaw, unusual or atypical femur fractures, digestive side effects, complications related to long-term use. And for a person with only mild bone thinning, the actual benefit may be smaller than many people realize. Another important point: if your initial bone density is normal or only mildly reduced, you often do not need repeat scanning every year or every 2 years. In many situations, follow-up intervals can be much longer. And this brings me to what I believe is often the most powerful intervention for bone health after 60: resistance training. Not endless cardio, not just walking slowly on a treadmill. Actual strength training with progressive load. Lifting weights, using resistance bands, working muscles against load. This has strong evidence for supporting bone density, strength, balance, and fall prevention. Pair that with good dietary calcium, adequate vitamin D, avoiding smoking, limiting excessive alcohol, staying active. That combination can do far more for long-term bone health than repeatedly scanning and reacting to every mild change. So yes, get evaluated when appropriate. But don't assume frequent scans and automatic medication are always the best next step. 4. Early Alzheimer's risk testing in people without real symptoms. The fourth one may be especially emotional, because it touches one of the biggest fears people have as they age: aggressive cognitive decline screening or early Alzheimer's testing in people who are not showing meaningful symptoms. This is a sensitive subject because so many families have been affected by dementia. It's understandable that someone in their 60s or 70s would want to know their risk in advance. But we have to be honest about where the science currently stands. At this moment, we do not have a cure for Alzheimer's disease. There are some newer treatments that may help slow progression in select patients at specific early stages, and that area of research is evolving. But for most healthy people without symptoms, early biomarker testing does not currently lead to dramatic, life-changing intervention. What it often does lead to is psychological burden. A person learns they carry a higher risk gene such as APOE4, or they find out that an imaging study suggests elevated amyloid in the brain, and suddenly they begin living under the shadow of a disease they may never actually develop in a disabling way. That can affect mood, sleep, planning, relationships, confidence, and quality of life. And that matters, because there is a major difference between helpful early diagnosis in someone with genuine signs of decline and preemptive testing in someone who is simply afraid. Many normal experiences of aging can be mistaken for disease. Forgetting a name for a moment, misplacing keys, needing a little longer to recall something occasional, mental fatigue, that alone does not mean dementia is beginning. For the average healthy adult over 60, diving into advanced genetic screening or amyloid imaging without a specific clinical reason may create more anxiety than benefit. So what would I focus on instead? The things we know support brain health: protecting cardiovascular health, controlling blood pressure and blood sugar, exercising regularly, sleeping well, staying socially connected, keeping the mind active, reducing isolation, learning new things, managing hearing loss if present. These are not glamorous, but they are powerful. And importantly, they improve overall health whether or not dementia ever becomes an issue. If you or your family are noticing real memory decline, functional changes, confusion, personality shifts, or safety concerns, absolutely seek medical evaluation. But broad early Alzheimer's testing in a person without meaningful symptoms is something I would approach very cautiously. 5. Routine PSA screening in men over 75. And now we come to the fifth checkup, one of the most debated topics in men's health: routine PSA testing for prostate cancer in men over 75. PSA testing has been controversial for years, and the reason is simple. Prostate cancer behaves very differently from many other cancers. In older men, especially those in their late 70s and 80s, small prostate cancers are extremely common. In fact, if you looked closely enough, many elderly men would have some prostate cancer cells present. But here is the critical detail. Most of those men will not die from prostate cancer. They may live with it for years without symptoms. They may never know it's there, and ultimately, they may pass away from something entirely different. The danger comes when routine PSA testing detects a slow-growing cancer that would never have become a meaningful threat, and then that diagnosis leads to treatment. And prostate cancer treatment can have serious consequences: urinary incontinence, erectile dysfunction, bowel issues, hormonal side effects, fatigue, major impact on quality of life. That is a very high price to pay for treating a cancer that may never have caused harm in the first place. This is why many major medical guidelines have moved away from recommending routine PSA screening in older men, especially when life expectancy is limited or other health conditions are already present. This isn't about neglecting older men. It's about recognizing that more screening is not automatically better, especially when the harms of detection and treatment may outweigh the benefit. Now, younger men with strong family history or certain higher risk backgrounds may have a different risk-benefit conversation. That should be individualized. But for a healthy man in his late 70s who is getting a PSA test simply because it's included on a routine checklist, that is something I would think very carefully about before agreeing to. What should men over 60 focus on instead? Maintaining a healthy body weight, regular exercise, eating more vegetables, reducing heavily processed foods, limiting processed meats, supporting metabolic health. Those habits influence far more than the prostate. They support the entire body. The bigger message. Now I want to step back for a moment because all of this points to a much larger principle that matters deeply after 60. And that principle is this: be an active participant in your healthcare. Don't just say yes automatically to every test on a standard checklist. Ask, why am I getting this test? What decision will change based on the result? What are the downsides? What happens if this finds something minor? Will this improve either my lifespan or my quality of life? Those are smart questions. Necessary questions, because medicine is an incredible field, but it also exists within systems, incentives, and industries. And sometimes, more testing means more business. That doesn't mean every test is bad. It simply means you should think critically. Your best guide is not fear-based marketing. It's a trusted physician who understands your personal history, your priorities, your family situation, and your real risk profile. Most of the time, the biggest drivers of health after 60 are not hidden abnormalities waiting to be uncovered by expensive scans. They are movement nutrition, sleep, stress regulation, meaningful relationships, purpose, consistency. The people who often age best are not always the ones who had the most tests done. They are the ones who live well, stay connected, stay active, stay curious, and use medical care thoughtfully rather than reflexively. And to be balanced, yes, there are absolutely screenings and evaluations after 60 that I strongly support. These include things like blood pressure checks, blood sugar or HbA1c cholesterol and lipid panels, eye exams, hearing checks, dental care, thyroid testing when appropriate, vitamin D in selected cases, skin exams based on sun exposure or history, colon cancer screening when indicated. These tests often give information that leads to clear, meaningful action. That is my standard. If a test is likely to lead to an intervention that meaningfully improves either how long I live or how well I live, it's worth serious consideration. But if the likely outcome is more fear, more procedures, more complications, and very little real benefit, then it deserves a thoughtful conversation first. Final thoughts. Let me leave you with something deeply personal from my years in medicine. One of the biggest lessons this profession has taught me is that certainty in medicine is rare. Medicine is not built on guarantees. It is built on probabilities. Every test has limitations. Every treatment has trade-offs. Every decision involves risk and benefit. And the older we get, the more important those trade-offs become. Because the best medicine is not always more medicine. Sometimes the best medicine is wisdom. The wisdom to know what to investigate. The wisdom to know when to intervene. And the wisdom to know when not to create problems that never needed to be solved. So I don't want you to leave this conversation feeling afraid. And I certainly don't want you to feel that doctors are trying to hurt patients. Most physicians genuinely want the best for the people they care for. What I do want is for you to leave feeling empowered, more confident asking questions, more informed in your decisions, and more aware that your health after 60 is not defined by how many tests you undergo. It is defined by how well you live. Thank you so much for spending this time with me today. If this message connected with you, share it with someone you care about. A spouse, a parent, a friend, anyone over 60 who may need to hear this perspective. And leave me a comment below. I'd love to hear your experience. Have you ever had a test that created more fear than clarity? Or do you see this differently? Honest, respectful conversation is what this channel is all about, and I truly value hearing from you. And if you haven't subscribed yet, make sure you do, because every week I bring you practical, evidence-informed health guidance designed especially for people in their 60s, 70s, and beyond. You deserve healthcare that truly serves you. I'm Dr. John, and I'll see you in the next one. Take care of yourselves.